I'm laughing. I shouldn't be laughing when I'm talking about hemorrhoids. Oh, too many gross words together. Anus filling with blood, poop, burning in the asshole. Okay. Do not be eating anything while you watch today's video. Hey everyone, I'm Abby Sharp. Welcome to another edition of Toilet Talk, where I get up close and personal with your porcelain throne to help you answer your dirtiest, darkest secrets. Today I've got a question from Straining Sally. Dear Abby, I have never had trouble with my bowels until I got pregnant and dealt with some serious pregnancy constipation. Then while delivering my daughter, I pushed so hard, I was left not only with some brutal tearing, but a pretty horrible case of hemorrhoids. One of my lowest points in my life was when I allowed myself to sneak a peek of what was going on back there, and I was convinced that there was a bum growing inside my bum. It was mildly traumatic. Forget about losing weight. What can I eat to help me get my ass back? Signed, Straining Sally. Time to get personal, lovelies. Let's talk about your anus. So hemorrhoids are essentially swollen veins inside the anal canal. They can happen outside the anal canal or they can happen inside the anal canal. How many times can we say anal? We will see. That'll be the big question for today, folks. While they're definitely pretty common and can be a little bit painful, they're usually not too serious. So some of the common symptoms of hemorrhoids are bleeding during bowel movements, itching, and rectal pain. So whenever too much pressure is put on our veins, both in our pelvic and rectal area, hemorrhoids can occur, and there's a few main reasons why. Number one, sitting on the toilet too long. When we sit on the toilet for too long, the increased pressure to move stool over time can cause the veins in the tissue to swell and stretch, which in turn can cause hemorrhoids. Number two, constipation and diarrhea. When we're not regular, the increased pressure and straining on our veins in our anal canal can cause hemorrhoids. And finally, pregnancy and labor. So it's very common in the last 6 months of pregnancy for women to experience a lot of pressure on some of the blood vessels in the pelvic region. And then during labor and delivery, when women are pushing a baby out, that straining motion and that pushing can often worsen or create hemorrhoids. So first of all, what do you do about hemorrhoids? So there are some over-the-counter medications and procedures that you can look into. If it's an external hemorrhoid situation, sometimes getting an over-the-counter ointment can help reduce the pain or the itching, and a stool softener can make it easier for you to have a bowel movement so that you're not straining further and exacerbating the hemorrhoids. If it's an internal hemorrhoid, a doctor sometimes needs to kind of go in with a simple procedure to help reduce the blood flow to the hemorrhoid so that it can shrink and go away. Number two, pump up that fiber. So fiber does wonders for the body. It is particularly important for regularity. So you want to focus on getting your 25 to 38 grams of fiber every single day. Also, if you're not quite used to getting a lot of fiber in your diet, you want to introduce it slowly so that your body can adjust over time. So some great sources of fiber to include in your diet are things like whole grains, like whole grain pastas and breads, and quinoa, as well as beans, legumes, and of course, lots of fruits and vegetables with the skin on. And of course, if you cannot get it from your diet, you can also try including in a fiber supplement. Number three, avoid constipation causing foods. So you want to cut back on some of the ultra-processed foods in your diet like candies, chips, crackers, cakes, things like that. Often these kinds of foods are devoid of any fiber, which we just talked about, and they should be kind of reduced when you're trying to treat your hemorrhoids. Number four, making sure you're staying hydrated. So water actually works in conjunction with fiber to help things move along. So you want to make sure that you're getting in lots of fluids throughout your day. Number five, take a bath. Getting into a nice pool of warm, soothing water is a great way to help relieve some of the pain and discomfort of hemorrhoids. Number six, exercise. Keeping yourself active is a great way to keep yourself regular and your bowels moving. So make sure you're getting in at least 30 minutes of activity every day. And number seven, keep your smartphone out of the washroom. So not only is this a hygiene thing, but smartphones tend to keep us on the toilet for a lot longer. And there's a new clinical trial actually happening right now that is looking at the incidence of hemorrhoids and smartphone use in the washroom. So I say keep your smartphones and your tablets out of the bathroom and focus on the business at hand. Well, Sally, I hope that answered some of your questions on what to do about your hemorrhoids. If your symptoms do not resolve themselves within a week, I definitely recommend following up with your doctor. I hope you guys all enjoyed this video. If you did, be sure to give it the thumbs up. Leave me a comment below with some of your burning toilet talk related questions. Subscribe to the channel, and I'll see you next time on Abby's Kitchen. Bye! I'm so excited about shits.